Greetings. I'm here with my good friend Dr. Adan Sanchez, who is a physician and lifestyle educator. He's coming to us from Uchee Pines Institute, where there's a lifestyle center and school associated with that. And he's in our neck of the woods giving some health presentations at a number of different locations. But we're just privileged to have him. Welcome, Dr. Sanchez.
Thank you, Josiah, for the invitation. Thank you for having me here. And also, it's always good to come back to Maine.
Excellent. Well, you're welcome anytime.
Thank you.
But by way of introduction, you've been practicing lifestyle medicine for over a decade, and so there's a lot that goes into that. But also, when we look at the top leading causes of death in the United States, and this goes for abroad also, we see things like heart disease, cancer, diabetes, Alzheimer's, renal diseases. What does lifestyle have to do with those things?
Oh, definitely. I mean, all these conditions that you just mentioned are going to be intimately related with my lifestyle, with my habit. One of the key points of lifestyle medicine is prevention, okay? But also, I will say that lifestyle medicine or lifestyle interventions are going to be very helpful if you want to reverse these chronic conditions that you mentioned.
Wow.
Specific, well, let's say it's high cholesterol, high triglycerides, diabetes, hypertension, obesity, fatty liver, right? And even chronic conditions, kidney conditions as well.
Okay, so it seems to be that these are lifestyle induced, and so in order to remedy them or to treat them or to even reverse them, it's going to take a lifestyle to do that.
Yeah,
okay.
You mentioned it very well. So if they are related with my lifestyle, so what do I need to pay attention to? I need to pay attention into my lifestyle, with my habits, I would say.
Sure. Is there a place for maybe more conventional approaches like pharmaceuticals and other modalities along with lifestyle?
Definitely. In many situations, the use of pharmaceuticals is going to be useful, right? Because in order to start changing the habit, well, I need some help in order to reduce my blood sugar levels, right? In order to reduce my blood pressure. And in that situation, well, there's a lot of room, I will say, to use those medications, right? Or conventional medicines.
Sure.
It's like a teamwork.
Yeah, absolutely.
Lifestyle medicines and conventional medicine.
So in order to stabilize an individual, maybe some conventional treatments or medications might be necessary or definitely necessary.
Oh, necessary, yeah.
Okay, excellent. Well, now going back to these top killers that are pervasive, especially in the United States, heart disease, hypertension, diabetes, Alzheimer's, all these things. Is there anything, and obesity, what is the common denominator between those?
Yeah.
Is there anything that unites them?
Yeah, there is a medical term that's called metabolic syndrome. Okay, and metabolic syndrome, it is going to be a cluster of conditions. For example, I didn't mention already these conditions: diabetes, type 2, hypertension, high triglycerides, high cholesterol levels, LDL, and having low HDL or good cholesterol, low levels. Okay, fatty liver could be related to as well, and kidney problems, and also obesity. If you have diagnosed or if you have been diagnosed with 3 of these diseases, you are considered as having metabolic syndrome.
So metabolic syndrome is a combination of 3 other diagnoses or 3 other symptoms, right?
Well, and the medical term is metabolic syndrome, but the actual diagnosis is when you have 3 of those 5 conditions that I just mentioned. Okay?
And those 5 conditions are largely our health crisis. Okay.
Yeah, so, because it's very common that a person is going to be having what? Obesity or being overweight, along with prediabetes or diabetes, and along with high levels of triglycerides and high levels of cholesterol.
And high blood
metabolic
pressure.
Syndrome.
And high blood pressure.
Exactly.
Okay.
Yeah.
Wow. So that's pretty common.
It's very common.
So it seems to be if we can understand more of the ins and outs of how metabolic syndrome works, what is the central player that affects all of those things, we'll be able to help ourselves and those around us reduce that. So what is kind of the central player from your perspective and from your research of that?
High insulin levels.
Okay.
High insulin levels, okay? that is going to be the main problem in order to develop all these cluster of conditions.
Usually when we think of insulin, we think of diabetes,
Yeah.
lower in order to lower the blood sugar. And that's really, where most of us stop. But you're saying that insulin levels, or especially high levels of insulin, can lead to heart disease, renal failure, fatty liver disease, all the cluster of the 5 that are in metabolic syndrome.
Yeah, definitely.
So you're going to have to walk us through that.
Oh yeah, because it's very, in a very simplistic way, I can say, okay, well, the main problem is high levels of insulin. But hey, so insulin is something wrong, it's something bad? Not really, because we need to have insulin in my system. If I wouldn't have insulin in my system, Josiah, I wouldn't be able to survive. I wouldn't be able to live. Okay, so but here's the problem. So when we are overproducing more than the necessary levels of insulin, it's when we are going to be having something that's called insulin resistance.
Okay.
Insulin resistance. Okay?
Before we get into what is insulin resistance, maybe talk to us, what is insulin? What is its function in the body?
Yeah, that's a good question. Okay, let's start with that. Insulin is a hormone. We know that it's going to modulate the levels of blood sugar. Okay, but also, as you mentioned, so insulin, diabetes, insulin, type 1 diabetes, right? It's correlated, and that's it. Well, there are some other functions of the insulin. And one of the functions of the insulin is going to be that it's an anabolic hormone, okay?
Okay, what does that mean?
Anabolic means storage.
Building up.
Building up, okay?
Okay.
Anabolic hormone. The other function is going to be related with growth hormone, okay? Growth hormone, okay?
We typically hear growth hormone with cancer or tumor growth.
Exactly.
Oh,
exactly.
boy.
So that's the link, because you remember, right? Insulin growth factor 1.
Yes.
Insulin is coming from insulin. It's one of the hormones that's going to trigger the cell growth, including cancer cells, right?
Wow.
And when you have high levels of insulin, you will have high levels of this hormone IGF-1, insulin growth factor 1, okay? So the other function of the insulin is going to be lipogenic hormone. Lipo means what?
Fat.
Fat, genesis.
Like Genesis, beginning or the start of.
Producing, okay? Producing fat hormone.
Wow. So insulin is a fat-producing hormone.
Oh, yeah, exactly.
And it also inhibits fat breakdown, right?
Yeah, that's another function. That's another function, because it's not only going to increase the fat production, but also it's going to prevent the breakdown of this fat, okay? So as you can see, there are many good or benefits from the insulin, but also when you have a high levels of these hormones, it's not going to be good. Why? Because high levels of insulin is going to be intimately related with weight gain.
Yep.
And also it's going to be very hard to lose weight when that insulin is high.
Well, that's understandable, because insulin causes weight gain because it's lipogenic, but then it's also, it stops the process of your, as you were saying, of fat breakdown.
Exactly.
Lipolysis, right? It stops that process.
Yeah.
Wow. Okay. So is there any success? Can you break away from that? How do you start to reduce insulin levels?
Okay, well, so how we are going to be doing that? Well, let's go back and let's explain a little bit what is insulin resistance, or what's the process of insulin resistance, okay?
And maybe how it works in the body a little bit.
Exactly.
Yeah. How does it actually modulate glucose?
Exactly, yeah, because that's one of the main functions, okay? All right, so after your meals, okay, you have been eating probably pizza,
okay,
probably potatoes, probably
how'd you
pasta.
know? How'd you know?
Well, it could be. It's possible. So all these refined carbohydrates, right, are going to be converted right away into sugar.
Glucose. Yep.
The main signal in order to produce insulin from your pancreas, which is the organ that we have in front of your stomach, right here, right?
Okay.
In the center of your stomach. It's going to be the first signal to produce insulin.
Okay, so the body doesn't like high levels of glucose within the bloodstream.
Exactly.
And how it regulates that is with insulin.
Perfect.
So
That's
insulin
correct.
gets secreted into the blood system, and then what happens?
Okay, so yeah, but okay, high levels of blood sugar because we have been eating a very high refined carbohydrate diet, high levels of insulin, okay, and then what? Well, the blood sugar has three pathways how we can utilize all this sugar, okay. The main one, well, not the main one, the first one, it's going to be use it as an energy right away, right after your meals, okay. That energy, that sugar is available as an energy.
Okay.
Okay, so that's why we do recommend digestive walks.
Yes, okay. So you're utilizing the glucose right from your meal, right as energy in your muscle cells.
Exactly.
So that's the first pathway.
That's the first pathway, okay? And this is quite important because if you are using some glucose already as an energy, you will have less sugar. You will be preventing spike or the
So
surge
you
of
lower
the
that
blood sugar.
surge of blood sugar.
Exactly, okay. So less blood sugar, less insulin. Remember, the key is here of all these situations, the key is maintain low levels of insulin. That's a key point, okay?
Okay.
Okay. Well, so the second pathway of the blood glucose is going to be glycogen. Okay.
So the insulin converts the glucose
into glycogen.
Okay.
What is glycogen? Glycogen is just a molecule of water and sugar. Storage in my liver and also in my muscle cells.
Oh, okay. We often hear about like how athletes before an event might do some carbo loading. Is that what they're doing? Building up their
the glycogen storage. Yeah.
Okay, so that they can use it the next day.
Exactly. That's a very important point, right? However, the glycogen storage in my liver has a limit. Okay, we cannot convert all my blood sugar into glycogen. We can't. Okay, so that's why. Well, that's why after we reach the point, the limit, all this blood sugar, it's going to be produced into fat.
And is that our third category of how insulin
That's
lowers?
a third pathway, converted all this blood sugar into fat.
So it goes, the first one that insulin helps with is utilize it directly in the muscle cells. Your digestive walk will help to lower that spike. The second one, it converts it into glycogen. Okay, that's cool too. But now we ate such a big meal, there's still a lot extra left over. Where does that go? That's the lipogenic aspect.
Lipogenic aspect.
Stores it in the form of fat.
Yeah, that's a good way to say it. That's the lipogenic aspect of the insulin, okay? However, you see how important is digestive walks.
Yeah.
How important is to change one habit instead of taking a nap after your meals, or instead of sitting down at the table, right?
Or on the couch.
Exactly. Yeah, 30 minutes, I don't know how long. Well, go, and take a walk.
Do something.
Do something. 20 minutes walk.
To lower that surge.
To lower the surge. And also, if you lower the blood sugar, less insulin. Okay.
Okay, the less insulin is required.
That's the key. That's the key.
Okay, and so the less lipogenic aspect of the insulin is going to be had, the less, inflammatory reaction.
We can say.
All these, okay.
Okay.
All right.
Okay, so let's see, because we are trying to explain insulin resistance, all right? Okay, well, all this fat, it's going to be sent to the liver and also sent to my muscle cells, okay?
Okay.
And we're going to realize that it's a vicious cycle.
Yeah, I can see that.
Why? Because all this fat is going to be sent into my muscle cells. The work of the insulin is introduce, right, glucose into my cells, specific my muscle cells and my adipose tissue cells.
Okay. Fat cells.
Fat cells, okay? And that's where the insulin is going to be working by the action of a transporter that's called GLUT4.
Okay.
So the insulin is coming into my cells, right? to my bloodstream, released by the pancreas, right? Because I have high levels of blood glucose, and then trying to introduce all this glucose into my cells, all right? But guess what? There is a resistance there, right?
Okay.
There is
So,
a resistance, right?
Can I just say this to see if I understand, if I'm tracking? So you have your carbohydrate-rich meal. There's high blood glucose levels. The body doesn't really like that because the glucose itself causes inflammation to the blood vessels, and so it just doesn't like high levels. And so the pancreas produces insulin to kind of lower. And what we typically say is that insulin is the key that unlocks the door to the cell. But not only that, there's another transporter within the cell called GLUT4, you said, that also helps to open the door from the inside?
Well,
is that right?
The work of the insulin is activate this transporter.
Oh,
we have the receptor. We have the receptor. As long as the insulin is binding that receptor, right?
Okay.
It's going to activate that transporter inside my cells in order to open that channel to introduce the blood glucose.
Okay, I never realized that stage. So insulin binds, activates GLUT4, and then GLUT4 opens the channel for glucose to come in.
Exactly.
Okay.
Yeah. Okay. Just remember that insulin is going to activate that transporter. Okay. However, there is another important part. Okay. There is another important ingredient, I will say, in order to activate that transporter. We're going to be talking more about it later. Okay. So once that's the normal way of function of insulin. Okay?
But we were on our way to insulin resistance.
Exactly.
Okay.
And as I mentioned, well, there is a resistance, right? The insulin is coming here, is not able to activate this transporter because it's something that's causing this impaired signaling. All right?
So there's something inside the cell that is inhibiting GLUT4 to respond to the insulin. And what is inside the cell that might be inhibiting that?
You know what? It's one component. It's called ceramides.
Okay,
and
which is a fat.
Ceramide is a fatty acid.
A fatty acid.
Okay, and this fatty acid or ceramide is coming only from, well, it's going to be produced by your system. I mean, by your cells. But if you have a very high levels of ceramides, of course, you will have a more insulin resistance. And when you are eating saturated fat, you are building up the production of ceramides.
Okay, so a high fat, especially saturated fat, is going to lead to more cells, more fat, more ceramide inside the cell.
Okay, plus the fat that you have been converting from glucose into fat. Okay, we have two components as well.
So the insulin is converting lipogenesis, the creation of fat, as a result of insulin, high levels. And so you've got two factors making it more difficult. You've got the ceramide and the fat that the insulin is causing to be produced.
We can say it that way.
Okay.
Okay. So, and then, well, so the insulin is coming, it's not able to open those channels. So all this glucose is going to remain in my blood system, in my bloodstream. All right. Well, so my pancreas is going to say, hey, Adan, so we have very high levels of very high levels of glucose. Well, let's produce more insulin.
Says, okay, I know how to reduce the blood glucose. I'll just produce more insulin.
More insulin, more insulin, more insulin. And
that could be a problem because, as we know, it's an anabolic hormone. It's going to lead
the function
to
of the insulin?
More fat production or storage.
And then we enter in a vicious cycle.
Wow.
A vicious cycle, okay? High levels of blood glucose, high levels of insulin, high levels of fat, insulin resistance, high levels of insulin. Sorry, high levels of glucose, high levels of insulin, high levels of fat.
It just gets higher and higher and higher.
Exactly. And look at this. I mean, we have been living for 10, 20, 30 years with this process. Well, we're going to get to the point where the pancreas is going to say, you know what? I cannot continue living or working this way. Okay,
let me see if I understand that. So, you know, if you're continuing to have a high refined carbohydrate rich diet and so regularly a lot of glucose within the bloodstream, and so the insulin has to produce the pancreas has to produce a lot of insulin to lower that. And then it's doing it often. It's making more fat, more ceramide and more fat in the cell. All of that's going on. And then you need more insulin to do the same job and more insulin on top of that to do the same job. And eventually those little beta cells in the pancreas get burned out.
They are gonna get burned out,
Okay, and they start to die.
They start to die. I mean, and even they say that when you have a diagnosis of diabetes, it's because around 50% of your beta cells are not producing insulin anymore. There's a declining of that production of insulin, okay, from your pancreas, and that, in that situation, you are already diagnosed with diabetes.
But we can start to recognize signs of pre-diabetes and
definitely.
signs and
Insulin resistance.
insulin resistance to be able to benefit or avoid or help heart disease, fatty liver disease, renal areas. And so maybe I'd like to ask a bit more of how directly, like we can already start to see it, but walk us through how this insulin resistance and insulin uncontrolled insulin levels leads to heart disease, leads to hypertension, leads to cirrhosis of the liver, these kind of things. And also, maybe this might help. You have a little bit of a testimony, something that you were recognizing about 8 years ago with your own insulin levels. Would that help introduce that?
Yeah. Just remember, many times you are gonna go with your clinician, right? And they will tell you your blood glucose is fine, your hemoglobin A1C is fine, which is the hemoglobin A1C is the average of the last 3 months of your blood glucose.
Okay, and what should that be?
Everything is fine. Okay, the
hemoglobin A1C.
Fasting blood glucose, it should be below 100.
Okay.
But if you want to have a perfect numbers, below 90. All right?
That's glucose levels, fasting glucose levels.
Okay, in the morning. Okay. So if you want to check for your hemoglobin A1C, which is the average of the last 3 months of your blood sugar, it has to be less than 5.7.
Okay, anything
5.4, 5.5, it will be a good number.
Anything above that would be pre-diabetes?
Pre-diabetes.
And then diabetes would be what?
Above 6.3, 6.4, it's considered as a diabetes already.
Yep.
Okay, so what happens? So you're going with your physician, your clinicians, and they say, don't worry about it. Your blood glucose is fine. You don't have to be concerned about pre-diabetes or diabetes. Yeah, but we don't check about insulin levels.
Oh, is it possible that your pancreas is working overboard to make sure that glucose level looks good?
Exactly. My glucose looks good. But why it looks good? Because my pancreas is overproducing, as we mentioned in the past, right?
Wow.
So that's a big problem because we don't really normally check for fasting insulin.
Wow.
It is true, it's not very accurate, but it's going to give you an idea.
An indicator.
An indicator, right? That if your insulin is higher than the normal levels,
you're on the track.
There's a warning. There's a warning that probably, you are on the track of insulin resistance or prediabetes. Okay, what happens with me 9 years ago? I checked for my blood work panel, and I did check for insulin, blood glucose, fasting blood glucose, and also hemoglobin A1C. All right, so everything was okay. My hemoglobin A1C was 5.5. My blood glucose was around 85, normal.
So it looked like from those two numbers, not even on track for diabetes or pre-diabetes.
Exactly, no
You're
problem.
in ideal range.
Exactly. But my insulin was on 19.
And what's normal?
Less than 7.
Wow.
It's a significant elevation.
So in order to get those normal hemoglobin A1C levels and those normal glucose levels, your pancreas was working overboard.
At that point, my pancreas was overworking to maintain my blood glucose levels, right? If you continue in this situation for 5 years, 10 years, 20 years, again, you will get to the point where the pancreas is get exhausted, overworking, right? And you are not going to be producing enough insulin anymore. So what's going to happen? Well, your blood sugar is going to
keep going up. It's going to go up exponentially, and then you're going to need maybe artificial insulin.
Probably, right? In many cases, right? So yeah. However, I did check my insulin last year, and my insulin levels were around 8.
Okay.
1 point above.
So you still got some work to do.
Yeah, 1 point. 1 point.
Excellent.
However, I will tell you that, well, I have to say that 9 years ago, my weight was not 135, 140. My weight was 178. So this, it leads us to the point that the main contributor for insulin resistance is going to be overweight or obesity. And Josiah, we don't need to have morbid obese to have insulin resistance. As long as we start to have this abdominal
fat. Okay.
We are going to be contributing
to insulin resistance.
That's one of the signs for insulin resistance. Okay.
Wow.
You don't need, I mean, if you want, get your blood work, check for insulin, right? But as long, friends, that you have already fat in your abdomen is just a sign that you are on insulin resistance. And then if you want to have, I mean, if you want to know more about insulin, or I mean, if you want to check more about some signs, well, or clinical signs, you can check for some dark colorations around your neck and also in your axillary area. That's another sign of insulin resistance. And this is called acanthosis nigricans, which is just the darkness or dark colorations in those areas. Very specific or linked to insulin resistance.
Wow. Okay, so we're talking a lot about insulin resistance and how it's connected to metabolic syndrome and how metabolic syndrome affects so many other things. I do want to mention to people that we are going to be, or you are going to be able giving some recommendations on how to reduce one's weight, how to combat obesity, how to, even not even obesity, just a little bit of weight gain, how to help yourself in many different recommendations, many different ways. So hang in there, but we want to understand a little bit more of the physiology behind this. So how is insulin and insulin resistance going to contribute to high blood pressure and heart disease?
Oh yeah, one of the problems, right, with insulin and high cardiac or heart conditions, remember, as long, I mean, you have already this problem with insulin resistance, your insulin is going to be high all the time, right? So the other function of the insulin, okay, which is not specific related with diabetes, it is going to be increasing your stress response, your sympathetic nervous system response from your brain, okay?
Wow, so the sympathetic nervous system response is the fight or flight response, the stress response.
Okay, exactly.
Which elevates cortisol.
Cortisol is going to be elevating adrenaline as well. And this is one of the main factors to produce what? Vasoconstrictions. Okay?
Wow.
So you have this sympathetic nervous system response from your brain, right? Stress response, sending the signal to your adrenal glands, that those glands or organ is on top of your kidneys, producing cortisol, producing adrenaline. All this cortisol and adrenaline is going to go into your arteries, okay? Vasoconstrictions. Okay?
Then we got hypertension.
And then we have hypertension.
So if you have chronic levels, high levels of insulin, you're going to have hypertension from this pathway. There's other pathways too.
There are many pathways for hypertension, but that's a factor. How it's related, high levels of insulin and hypertension. Well, the other factor is that insulin is going to trigger the absorption of more sodium from your kidneys or salt.
Which would lead to more oxidative stress.
Oxidative stress or oxidations, which is going to lead to the damage of the lining of your endothelium. If you damage the lining of your endothelium, you are not producing nitric oxide.
Wow.
Okay. Which is a powerful vasodilator.
Let me just break that down, because you're using a lot of medical terminology here. And so you're saying that insulin, high levels of insulin, actually cause increase in your stress response, in your cortisol, adrenaline, so your fight or flight response, okay? But on top of that, it also inhibits or increases your absorption of salt.
Exactly.
Which increases inflammation or oxidation, inside your blood vessels. And those cells are called endothelial cells, the ones that are inside. And so those endothelial cells produce something called nitric oxide, which is a powerful vasodilator.
Okay, to open those arteries.
And so that's not happening though. it's not happening because
Well,
there's more of that insulin?
There's a damage already. There's
Wow,
a damage.
okay.
Yeah.
So that damage, does that attract anything? What happens?
Well, okay. So, okay. The other point, remember that the insulin is going to produce what? High levels of cholesterol and high levels of triglycerides. Okay. So all these situations are going to promote, by mechanism, they are going to promote inflammation inside my vessels. Okay, or damage to the endothelial cells. Okay, producing what? Arteriosclerosis, with its stiffness of the arteries. Okay.
Okay.
In order to have a good cardiovascular health, you need to have a good elasticity.
Right? Needs to be able to move, but arteriosclerosis is the hardening of the blood vessels, and they're not able to expand or constrict.
That's one of the mechanisms. That's one of the factors, right? And let's see. Okay, so you have a damage already in your endothelial layer. Okay?
Inside the blood vessel.
Inside the blood vessels. Okay.
Yep.
We have the endothelial layer is here. We have damage there. Well, the immune system is going to be trying to repair that damage. Okay.
So white blood cells are going to come?
In the process of repairing that damage, white blood cells are going to start to do their job, right? And in the process, well, they are going to be attracting some other chemicals, inflammatory chemicals, right?
Okay.
For
Which is a
example,
part of the healing sometimes.
it's a part of the healing, right?
Yeah.
I mean, inflammation is good.
Yeah.
We need inflammation.
But too much
but
is not good.
Too much is not good, exactly. So in the process of repairing this damage, you are attracting immune system cells, right? And then you are going to be attracting some other chemicals, inflammatory chemicals. And on top of that, you have a high levels of uric acid, okay? In what individuals will have a high levels of uric acid?
Those with gout or those who eat a lot of meat, actually, animal products.
Exactly. We need to have a high levels of homocysteine, right? Homocysteine is just an amino acid that's going to promote inflammation in those vessels as well. Also is related to dementia.
We need to have it?
No, we need to have a low levels of homocysteine because I'm just mentioned many factors that are going to impair or are going to damage the lining of that vessels, okay?
Okay.
High levels of uric acid, high levels of homocysteine, okay? Which if you supplement with B complex, you will be lowering the levels of homocysteine. Okay?
So how does one get high levels of homocysteine and uric acid?
Well, I mean, meat eaters. Meat eaters.
All
I mean, it's going to be the main source of these components, right? And then let's see, you have also high levels of iron. Okay, iron. Okay, iron by itself is going to promote inflammations. Okay.
Really? Is it normal levels of iron, or
high
when
levels,
it's high levels of iron?
High levels of iron.
Okay.
Remember that all these chemicals are going to damage the lining, right, of the arteries. Well, so when you have a very high levels of iron, it's going to promote inflammation, and also it's going to, because the frictions, okay, is going to promote also that damage, okay?
Okay, so you mentioned earlier arachidonic acid. Is that one of those chemicals that would be involved here?
Well, arachidonic acid is one of the elements, or is one of the main cause of inflammation. We're going to get to that point.
Okay.
Okay.
So we have homocysteine, uric acid, iron, and what was the other one?
Well, let's say it's arachidonic acid. Okay.
They all play a role in this inflammatory response that's taking place within the blood vessel at this moment. Okay.
High levels of proteins, high levels of inflammatory chemicals I did mention, okay?
Yep.
So in the process, right, of that repairing the damage, you are going to be attracting also, I didn't mention this, because it's going to, the main components is going to cause the damage of the lining of the layer of the vessel is going to be high levels of glucose and high levels of insulin.
So both insulin and glucose are pro-inflammatory.
Pro-inflammatory.
So we've got, let me just break this down. So we have homocysteine, we've got uric acid, we have iron, all these in high levels, of course. We have the glucose itself causes inflammation, and insulin and arachidonic acid stimulates that inflammatory cascade. So all of those doesn't sound good.
No, it's
in the blood vessel.
Exactly. It's the it's a good recipe, yeah, to produce a heart attack or to produce or develop hypertension. So there is a damage already. Let's go back. Damage. In the process of repairing the damage, you are going to be attracting some cholesterol in that site. Okay.
Does that form like a scab over it?
Something like that,
Yep.
And then you are going to be starting to produce the plaque of cholesterol. Okay, and after the plaque of cholesterol, we can call it as atherosclerosis, right? The plaque of cholesterol, right? And when this plaque of cholesterol is going to cause a rupture, it's called atheroma. Okay, well, it's just the rupture of the plaque of cholesterol. Okay,
Sure.
but something very important.
And that's the dangerous part in the form of a
That's
stroke
the dangerous part.
or a heart attack.
Exactly, yeah, because you can have the plaque of cholesterol for many years. But if you don't have a process that's called lipid or LDL lipid oxidation, you can be okay to certain extent, okay? You can be okay to certain extent, okay? But the problem is going to happen when that plaque of cholesterol is going to rupture and travel into very tiny arteries or vessels in your heart, right?
And cause a blockage.
Cause a blockage.
So no more blood can go downstream.
Exactly.
So
Exactly.
So let's look at for a moment what causes that rupture.
Lipid. Exactly.
And then anything can help to prevent that rupture?
There are many factors, but they have found that the more important factors in the rupture of the plaque of cholesterol, as I mentioned, lipid oxidation, LDL oxidation, which is a process of inflammation. It's going to be, again, arachidonic acid, insulin, and sugar, or sugar and insulin. Okay,
So that's what causes it.
exactly.
Anything to help reverse it?
Well, so in order to prevent this lipid or LDL oxidation inside the plaque of cholesterol, there's only one thing that can prevent this, and it's vitamin E. Vitamin E has the capacity to prevent this lipid oxidation. So now, where we're going to find vitamin E? Olives, avocados,
Yes.
nuts, almonds. What else?
Well, now, in some cases, like obviously there has to
Pumpkin
be
seeds.
moderation because
Yeah.
that's also fat, right?
Exactly, yeah. It should be a moderation of
Yep.
these items that we need to take on board almost every day, some of them, right?
Sometimes people like me might go, if a little's good, a lot's better. But that's not always the case.
No, because we need to remember about temperance, right? Or moderation, or self-control, right?
Okay.
Okay, well, but I wanted to mention something very important because you mentioned about arachidonic acid, okay?
Yes.
Which is not related with spiders, it's not related with all these
Not
insects.
arachnoids.
No.
But arachidonic acid.
Arachidonic acid, which
Yeah.
is just a fatty acid,
Yep.
okay? This arachidonic acid is the main component to produce all this cascade of inflammation, okay? The redness, the pain, the fever, the lack of function of this organ, okay? And also all these cardinal signs of inflammation are going to be related with arachidonic acid, but not specific with arachidonic acid. It's going to be related with all the byproducts or the products from the arachidonic acid, okay? Leukotrienes, which is related to asthma or any other allergies, okay?
Okay.
Prostacyclins, okay? Thromboxans, which is related to blood clots, okay? And prostaglandins, which is going to be related with fever and many others inflammatory signs, okay?
This sounds like a cytokine storm. Is
Exactly,
that right?
a cytokine storm, right?
Okay.
Or a cytokines. Well, let's say cytokines, because all these chemicals are called cytokines, but when you have a very high levels of cytokines, we can call it cytokine storm. And this term, remember, they were using it a lot during COVID-19 because all these individuals, at the end, they were having all these complications because all these chemicals, byproducts from this arachidonic acid, which is related to the function of your immune system.
Wow.
Arachidonic acid is essential. We need arachidonic acid, okay? We need prostaglandins, we need leukotrienes, we need all these cytokines
but in high levels.
That's the problem.
Okay.
That's a problem. Remember something very important, right? And even this is kind of like spiritual lesson as well. Balance,
Yep.
homeostasis, equilibrium, right? We need arachidonic acid, but not in very high levels. We need prostaglandins, but not in very high levels, okay?
We want inflammation when we sprain our ankle to help
Exactly.
immobilize that ankle.
By the
But
way,
we don't want that to be inflamed all the time, or else we wouldn't be able to utilize it. So
exactly. By the way, I mean, that's why all these medications, for example, aspirin, is going to damage your kidneys. It's going to damage the production of mucus layer in your stomach. Why? Because you need prostaglandins in order to have a good blood flow for your kidneys.
And aspirin stops that process.
Exactly. Okay. Why? Because the aspirin is going to be blocking one of the pathways that's coming from the arachidonic acid. But the only way how you can increase this arachidonic acid is when you are eating animal products. So the highest the consumption of animal products, the highest of the chance to be in a very or pro-inflammatory environment.
Wow, okay. So there are anti-inflammatory foods and pro-inflammatory foods. And we're not going to go down that talk because that's a different talk.
That's a different talk.
But in this case, animal-based foods are going to be pro-inflammatory because of the arachidonic acid.
That's correct. That's correct. But let's go back a little bit to the heart attacks, okay?
Yeah, okay.
And then we are going to go...
We need to go back to metabolic syndrome and the root cause insulin resistance.
Yeah. So heart attacks, okay? Because this is related with arachidonic acid, okay? Remember the platelets, okay?
Yep.
The platelets is the molecule.
Blood clotting.
Exactly. Blood clotting molecule, right? That is going to prevent bleeding and it's going to prevent, specific bleeding, okay? Producing blood clots. Surrounding the platelets, we have omega-3 fatty acid and we have arachidonic acid. But they are saying now the highest the amount of arachidonic acid and the lowest the amount of arachidonic acid is the major predictor for heart attacks. Why?
Wait, I didn't quite follow that. So the higher the level arachidonic acid and the lower the level arachidonic acid?
That's kind of like the high risk to develop.
So if you're high or low in arachidonic acid?
No. What I meant is if you have very high levels of arachidonic acid and very low levels of omega-3 fatty acids, you are going to be more prompt to develop blood clots. For example,
so we want lower levels of arachidonic acid and higher levels
of omega-3s.
Okay.
Omega-3s. Remember, the plaque of cholesterol was ruptured already, okay? It's traveling into your
blood vessel, smaller blood vessel.
It's going to be crashing to the platelets, okay? And the place, hey, what's going on? What's going on? There's something, there is a stranger here, you know? Let's to produce, or with this friction, the arachidonic acid is going to exert the signal to the platelets to produce a blood clot.
And so that main thrombosis, is that right? That gets flaked off. Does the clotting action start happening around it?
Oh yeah.
And it gets bigger and bigger.
Exactly.
So that little flake became bigger and bigger.
But the trigger
because of the platelets.
Exactly.
Because of the arachidonic acid.
Exactly. The trigger is going to be arachidonic acid.
Wow. Okay.
So yeah, that's another component for inflammation. Okay.
Well, we're going pretty deep in the pathophysiology there, but hang in there because we're going to, as a result of understanding the physiology, understand how to remedy it. And it's really going to be beautiful. So, but now are we at a good point to transition back to insulin resistance?
How to treat?
Yeah, how to increase our insulin sensitivity. Okay, so we've talked about insulin, high levels of insulin being pro-inflammatory. It's lipogenic. It inhibits lipolysis, meaning it reduces the ability to break down and use fat as energy, and lipogenic meaning it produces fat. Okay, and some other things. Oh, it actually stimulates the stress response. High levels of insulin. And another thing I was thinking too, while you were mentioning that part, if you're stressed out, are you going to be able to sleep well?
Right? Oh yeah, so, definitely. I didn't mention that.
Yeah, I know, but we could go everywhere with this. But let's go back and see. So we have insulin resistance because of the ceramide the fat inside the cell, which sometimes they call intramyocellular lipids, right? The fat inside the cell inhibiting the insulin to be able to couple with the insulin receptor. Therefore, the GLUT4 molecule can't allow glucose to come into the cell. And so the pancreas responds by producing more insulin. And so you have more insulin and more insulin and more insulin to be able to get the glucose into the cell. And that's the vicious cycle, along with all the other complications that Dr. Sanchez is teaching us about. So now let's get to the good news. The good news is that Jesus loves you and he's paid the price so you can live forever with him. But more specifically, the good news is how do we reverse this insulin resistance and increase our insulin sensitivity?
Yeah, as we mentioned, Ronald, in the beginning, how lifestyle is going to play an important role in reversing this condition. And let's start with nutrition. Plant-based diet.
Okay.
It's very important, right, to have a very low, well, not very low, avoid at all cost refined carbohydrates.
Okay, what is a refined carbohydrate?
Refined carbohydrates, I'm talking about white bread, about all these pizza, burgers, white pasta, right? And if you want to eat some carbohydrates, just make sure that they are going to be complex carbohydrates, okay?
And complex carbohydrates, meaning they're in the entire package that God created them in. So with the fiber, with the nutrients,
fiber.
not stripped of fiber and other B vitamins and things like that. In the case of white bread, that's what they do. They take much of the B vitamins out and the other nutrition along with the fiber so that it'll be able to store a little bit longer. And so now you're just eating straight glucose. The glycemic index, meaning the degree to which it increases your blood glucose level, is very high. So if you eat whole foods, you're going to be eating foods high in fiber that will not raise your blood sugar. So not have that spike.
Exactly.
And not cause the insulin to be super high.
Exactly. Not only that, but remember that fiber is going to reduce the levels of cholesterol as well, like flushing out that cholesterol.
Oh, yes.
Okay, so let's talk about...
It kind of sweeps out the whole digestive tract as it goes through and you defecate.
So remember, when you are talking about plant-based diet, legumes, okay?
It's all right. We can get through it, folks. Okay, talking about legumes, how does legumes increase insulin sensitivity?
Well, there's a lot of research about that legumes, specific lentils. You can correct that, right?
Yeah. Okay. Okay, let's go.
Yeah, you're gonna cut it out. Yeah, okay. Yeah, you can cut it out. Okay.
Legumes.
Okay. All right. So talking about plant-based diet, remember that one of the components of plant-based diet, it is going to be legumes. For example, lentils, garbanzos,
high in fiber.
High in fiber, right? And also beans, black beans, pinto beans, soybeans, right? All these legumes are going to be reducing insulin resistance by itself. I haven't found any article that is saying that when you are eating legumes, the insulin resistance is going to increase. No, it's totally the opposite, okay? However, again, we need to be mindful, okay? Moderation. Grains, wheat, oats, right? They are going to be good in order to, of course, when they are in a whole, right? With fiber, as you were mentioned, right? We can utilize to really treat this insulin resistance. Well, let's talk about fruits. Fruits in general, they are very important because of fiber, you were saying, right? Nuts, almonds, pecans, well, all the components of the plant-based diet is very important. So the first point in order to treat and reverse insulin resistance is going to be change your diet. And very important, no animal products for all the situations that we spoke already.
A cytokine storm, inflammations,
and all this, okay? Let's move on to the second part about exercise. Exercise, right? Exercise is very important. I didn't mention, I mentioned that the insulin, the receptor of the insulin, or the transporter for the glucose is going to be activated by the insulin, right?
So GLUT4 activated by insulin.
Insulin. However, these transporters have to mobilize to that layer of the cell in order to open the channel. Well, the insulin is not going to be doing that work. Just the exercise. The exercise, when we are exercising, we are producing many chemicals, which all these chemicals inside my cells are going to mobilize or translocate this transporter GLUT4 into the layer of my cells. So now we can introduce glucose.
That's pretty significant, and I've actually never heard that before. So you're telling me insulin comes in, triggers GLUT4 to do something, but exercise is actually what, and the chemicals that happen as a result is what actually gets GLUT4 to the cell membrane, which allows the door to be open for glucose to come in. Do you know the details of how that exercise triggers GLUT4?
Yeah, I mean, when you are exercising, you are going to be producing high levels of AMPK, which is an enzyme, which is going to, by the way, it's an enzyme that's related with longevity now.
Yes,
and if you have very high
of
levels of AMPK, you are going to be reversing the aging process, by the way. Okay?
Increasing telomere length.
Exactly. It's related with telomere.
That's a different...
That's another topic.
We're just going to leave it.
Hey, we are not going to be stopped today, I think so, right? Okay, so then you are going to be producing calcium. You are going to be producing nitric oxide. And
as a result of exercise.
Exactly.
And nitric oxide is a vasodilator.
Yeah.
So, okay.
But in this context, it's going to stimulate that GLUT4. And another component, because that's what I'm saying, inflammation is not bad when it's normal, because we need some levels of some sort of inflammation, okay? Because in the process to activate this element, GLUT4, by the exercise, we are going to be producing ROS, or reactive oxygen species. Okay, a byproduct of the inflammation process, okay, or the byproduct of oxidation, okay.
But in healthy amounts.
In a healthy amount, definitely in healthy amounts, okay. Even that's the way how we are multiplying our mitochondria. That's the same kind of like a mechanism.
Wow, okay.
By exercise, yeah.
Well, we're talking about exercise now, right? We're on that benefit.
Sorry,
so we talked about nutrition. Now we're talking about exercise. And I asked the question and I got the answer. So stay with us here. That was a really awesome, you're speaking my language. I really like learning that stuff. But let's get more practical here.
Yeah. Okay.
Go for it.
Okay, so more practical. What to do? After your meals, 20 minutes walk.
Go for a walk. And what's happening?
Every meal.
And what's happening after that walk? The glucose is going into the cells and being used readily, lowering the glucose levels,
Here the key is preventing the surge of the glucose.
And lowering the need for the pancreas to produce as much insulin.
Second, you need to do resistance exercise. Weight lifting is very important. Why? Because the higher the tone of your muscles, the lower insulin resistance you will have, or the higher insulin sensitivity you will have. Okay? So it's very important. If you are not working in your farm, you need to do resistance exercise. Very important. Squats. Very important to maintain a good tone of your legs.
Why specifically your legs?
Exactly. That's a good point, because the bigger the muscle, the bigger or the higher the absorption of glucose.
And the more control you're going to have to block that surge. And another thing, with that muscle training, with that exercise, you're actually going to be increasing the amount and quantity of mitochondria within your muscle cells, which is going to increase your capacity to absorb glucose, but it's also going to be increasing your capacity to produce lactate and other things. So it's very good to increase your mitochondrial density, as they say.
Exactly, But in this context, I mean, the bigger the muscle, I don't want to say the bigger the muscle, but the more exercise or the more stress you put into your muscles, the less glucose you will have in your system, okay?
But do you need to go back to the squat rack after every meal? Or you were saying earlier, it's just simple walking?
Simple walking. Simple walking, 20 minutes of simple walking after your meals. So now, if you really want to move forward in your exercise, hey, it is good to do exercise in the morning, right? and also to do some sort of resistance exercise in the afternoon. Just be careful. If you never did
exercise before.
Exercise before.
Work with a
like,
personal trainer,
exactly,
or work with
yes.
somebody. Get on a program.
Be careful with that.
This is where we're going back to the interdisciplinary approach. You need
Yeah.
to work with your healthcare provider and others. So
Definitely.
this actually transitions really nicely into what I would say is probably the apex of our conversation. We're going to talk about fasting, but you said, why exercise in the morning?
Okay. Why exercise in the morning? Well, let's start with fasting.
Okay.
After 10 or 12 hours of fasting, it depends and varies between different individuals. Okay. You won't have more glycogen. Remember glycogen?
Mm-hmm.
Okay.
I remember it like it was yesterday.
Yeah. Okay. That glycogen is going to be used already.
Because you mentioned earlier that the amount of glycogen that you can store is limited. And
Yeah.
so we can only... And
It's
so
gonna
the
last-
carbo... Yeah.
10 to 12 hours.
So it lasts 10 to 12 hours. And so after you utilize your glycogen stores, what do you use for fuel now?
Exactly. So you don't have more glucose because the glycogen is going to be converted in glucose, right? When you are not eating.
Is that gluconeogenesis?
Exactly.
Okay.
Or glycogenolysis or gluconeogenesis. Okay.
Yep.
So in that context, okay, so that the liver is saying, hey, I don't have more glycogen to produce glucose. Well, let's utilize what? Fat. Fatty acid storage in my liver.
Okay.
Okay. And then low levels of blood glucose. We need another source of energy. The liver is going to replenish this
Glucose levels, fuel source?
It's not going to be glucose.
Yeah.
It's going to be
Fatty acids.
fatty acids. And the name of these fatty acids is ketones.
Ah, we've heard that word
Exactly, right? Ketones. I mean, you heard about keto diet. You
Yep.
heard about ketosis, right? Well, this is very important because after 12 hours of fasting, you are going to be maintaining your normal function of your system with ketones. Most likely. I wouldn't say 100% not, but
So a mild state of ketosis.
exactly, mild, very mild state of ketosis.
And the longer you go, the more intense that state would become.
We'll say if you stay fasting for 3 or 4 days, well, you will get to the point where you are just functioning with ketones. Okay?
And so you're burning fat.
You are burning fat to produce another source of energy.
Okay. So getting this back to the exercise in the morning, but before we do that, so insulin was an anabolic hormone, which means building up, storing fat, and putting away stuff for the time of trouble, so to speak, right? What is the opposite of the anabolic hormone that contributes to this?
Remember that I did mention homeostasis, equilibrium, a balance. Okay, well, God created us with another hormone. It's called glucagon. Okay? The work of the glucagon is going to be the opposite than the work of the insulin. Okay,
So one was anabolic
and the other one is
catabolic.
catabolic.
Okay.
Breakdown.
So one builds up, stores fat, and the other breaks down fat.
Exactly, and we are looking for that point. And this is very important because as long as you have very high levels of insulin, the glucagon is going to be low.
But
If you reversed this shift, okay, the insulin goes down, the glucagon is going to go high. And that glucagon is going to send a signal to your liver, hey, we need more energy. From where? From fat.
Fatty
you have a lot of
acids.
fat from all these 20, 30 years that you have been eating all this junk food, I would say, right?
Or even decent food, but a lot of it, right?
Definitely.
Okay.
Yeah, even decent food. Okay. Yeah. So,
And so, just a quick physiology question. Does glucagon trigger the gluconeogenesis? Glycogen, taking that also?
Yeah.
So glucagon
Yeah.
is responsible for getting glucose back into the bloodstream to be able to, function.
Yeah, that's a good point. That's a
Okay.
good point because when you have a low levels of glucose, or hypoglycemia, boom, they're going to inject glucagon to produce more glucose, okay, from the liver. All right. So, but how we are going to be doing this? Fasting more than 10 hours every day? Well,
you were just saying, if you could just fast for 10 to 12 hours, I was just thinking in my mind, if you were to eat breakfast at like 8 or 9 o'clock in the morning, and if you just ate breakfast, you fasted until you ate breakfast again, that'd be 24 hours.
Well, that's 24 hours. I mean,
and that's a lot of time in mild ketosis, burning fat.
At least we are going to be 14 hours at least.
Okay.
12 to 14 hours in mild ketosis.
So let me ask you a question. You mentioned earlier if you exercise before breakfast. Now this makes sense because if you're exercising before breakfast, what are you using for fuel?
Exactly, just fat, just fatty acids. But let's go back first. Let's go back first because you can fast for 24 hours, I mean, if you are eating your breakfast, but what about if we can do this intermittent fasting? 2 meals a day, a good breakfast, a good lunch, having apart 6 hours between meals.
That's even
because
easier.
This is very important.
That's even easier and more doable for anyone.
How many hours are you going to be fasting every day? Well, at least 18 hours.
Yeah, could be. Depends on when you do your meals.
Exactly. It doesn't have to be more than 5 to 6 hours apart, okay?
So let's say
eating between meals.
Let's say you eat breakfast at 8, you could eat again at 2.
Yeah.
And that would give you
exactly
around 18 hours?
18 hours of fasting.
Okay.
At least you are going to be every day from 6 to 8 hours of mild ketosis every day.
Burning fat.
Which is very, very healthy if you want to maintain good cognition, okay? If you want to even help your heart, but the most important part, if you want to reverse fatty liver.
Oh, right.
If you want to reverse fatty liver, that's the main way to reverse fatty liver. Or even if you want to do this liver detox or liver cleanse, friends, just fasting.
The best liver detox is not dandelion tea or other things. It is just fasting.
It might be helpful, however, 100% by the mechanism, it is going to be fasting, the main treatment for fatty liver. Why? Because you are going to be stimulating the energy production from ketones, which is just a fatty acids. Okay?
Wow. So anybody interested in increasing insulin sensitivity, the degree to which that insulin molecule can bind with the muscle cell, fasting is going to do that because you're burning the ceramides, you're burning the fat, you're burning the intracellular lipids, you're also burning your fat stores in your liver and using that for fuel. So this is like a win-win all around. You're helping your body,
I mean,
helping your
losing
mind.
Weight.
Yep, because now your body is not always, occupied with digesting food. It can actually rest and take care of other things. Wow. Yeah. That's very significant and very doable. Like sometimes I naturally just eat 2 meals a day, but sometimes my second meal, like I do it because I'm busy. I eat breakfast and I don't eat anything until I get home. That doesn't work. That defeats the purpose if I eat at night, right?
Exactly, yeah. The best or the correct way to do intermittent fasting is breakfast and lunch.
So your meals have to be close
and supper.
5 to 6 hours apart.
5 to 6 hours apart. Okay. There is not it's not healthy to eat between meals. Not even an apple, not even a green juice, not even a fruit juice, not even a tea with honey or sugar. No.
Because that stimulates the pancreas to produce insulin.
Exactly. And we don't want that. Remember, the key point of all this talk is going to be reduce the levels of insulin.
Wow. Okay. And you might even be thinking, but I don't have a diabetes issue. I don't have a glucose issue. But you may have an insulin issue, which is going to lead to a glucose issue.
Probably not now. You don't have any signs or any blood work revealing, right, that your glucose is high. But if you are overweight, you are developing insulin resistance already.
Now, I have a question, because sometimes you can have a fit or what looks to be a healthy individual that has prediabetes. And so is it true that it doesn't always necessarily matter how much weight you're carrying, but how much weight is inside the cell or how much fat is inside the cell?
Yeah, definitely. And remember, I mean, it's not just, I mean, insulin resistance or prediabetes, diabetes is not just related with obesity or being overweight, but also is related with stress response, okay? Cortisol by itself is going to block the receptors of the insulin producing by another mechanism, insulin resistance, right? That's another component.
So in somebody that is healthy, if they're going through a very stressful circumstance for especially an extended period of time, they're going to be inhibiting the insulin receptivity. They're going to be making it more difficult for that insulin molecule to bind to your cell to allow the GLUT4 and allow the glucose to come in. Wow, so stress alone can cause it.
Yeah, cortisol. And the other topic, I mean, another component, sleep.
Yeah.
When you're not sleeping, high levels of cortisol, right? Stressing out all the time, high levels of cortisol, right? Producing insulin resistance as well.
Wow.
All right, so nutrition, exercise, intermittent fasting or 24 hours fasting, as the way you're saying, or the way how I mention all the time, okay? Eat your breakfast, don't eat anything till next day, eat your breakfast next day, okay? This is gonna be easier to a certain extent, right? To do fasting. Sleep well, temperance or moderation, right? And I will say the most important part, well, trusting in God.
Trust in God, and that's going to help with the stress.
Exactly.
Wow.
90% of all the disease originate in the mind because lack of trust, as you mentioned before, right?
Wow.
So you see how, I don't want to say how simple, but this is the way how we have been living, many of us, for many years. It's just cause and effect. There is a cost, and automatically will have the effect.
And a little bit of a silver lining and hope. In your 17-day program at Uchee Pines, how quickly do you see somebody who's been living this way for 20 years and their insulin levels are, maybe throw some numbers on that, high, and their glucose levels are high, and they've got metabolic syndrome, hypertension, cardiovascular disease, and diabetes. How quickly do those things start to reverse?
How quickly? It's a very important question.
I know this would vary from person to person.
As soon as you start to change the habit, I mean, everything gets corrected.
Wow.
Yeah, I have a person that I was seeing last year around September, I believe. This individual with a weight of 332 pounds.
Wow.
Okay. Hemoglobin A1C in 13.3.
When it should be below 5.3 or 4?
5.6, below 5.6.
Okay.
13.3, we are talking about very uncontrolled diabetes.
Yes.
And the fasting blood glucose in the morning was 303.
Wow. What was his insulin levels?
Insulin levels in this situation, the insulin levels were low.
Like, what are we talking low?
Well, I mean, for him, it was around, I don't remember very well, but it was around 15, which is telling me something.
It's still high, though.
Still high, but it's telling me something.
What is it telling you?
That for that high amount of blood glucose, I will be expecting to have like a 40 or 60 of insulin. He was declining already in the production of insulin.
Oh, his pancreas was already dying.
Exactly.
Okay, because I was thinking like, oh, that's good. Insulin level's not that, but it's already declining.
It's already declining.
Wow. So this is very advanced stage.
Right, exactly. You have an obese individual, right?
Wow.
For many years, and then you check the blood work. The blood work of the blood glucose is 300, but the blood glucose the insulin is low. What is telling me?
It's declining.
It's declining.
The beta cells are dying.
It doesn't match. It doesn't match.
You said earlier that diabetes, already 90% of the beta cells are dead.
Exactly.
So what are we at? 1%? I don't know.
Sure.
Yeah.
I'm not
we don't know.
Right?
But very low.
It was very low.
But there's still hope.
Definitely. Okay. So this individual is the other point with this individual is that he was not able to walk. A very severe edema, or severe edema, bilateral edema, both extremities, and he was not really able to walk. Okay, he was walking with a walker. Okay, just at the parking lot. The first week, he stayed with us for 1 month. In 1 month, doing or changing the lifestyle, nutrition, walking after meals, walking in the morning or evening, afternoon. I mean, fasting. He started to fast 1 or 2 days every week. The first week he fasted for 3 days in a row. Anyways, when he left, he was losing already 40 pounds.
Wow.
Okay, and the blood sugar was already dropping. I saw him 2 months after my first interview with him, right? And at that point, he was losing already 70 pounds.
Okay.
The blood glucose was almost normal. Okay, and
Normal would be what?
Well, below 100.
Below 100.
From 300 to 100.
Wow.
And the hemoglobin A1C, it was already 5.8.
And it was 13 point something?
Exactly.
Wow. That's 2 months after.
2 months after.
Okay.
I saw him 2 weeks ago. By the way, I was walking with him around the farm there at Yuchi Pines.
Wow.
And I was so
Which is
glad.
big.
It was big because remember, I mean, a few months ago, he was not able even to walk. He was walking just around the parking lot.
Yeah.
Okay.
And what I was
now,
referring to, the farm is big.
Oh,
Yeah.
okay.
That's a big walk.
Okay, exactly. Yeah.
That's a big walk.
But yeah, it was not just the farm. I mean, because
The entire center.
exactly
The
this
entire campus.
individual lives like 1.5 miles from the institution, from campus. And he told me, hey, you know what, Dr. Adan, now on average, I am walking at least 120 miles every month,
Wow.
which means at least 4 miles every day. From my homes to the institution, walking around the farm, going back twice or 3 times a day sometimes.
Wow.
Okay.
And do you know his current numbers?
The current numbers of his blood sugar, I am not sure, but he told me my numbers runs between 65 and 90.
That's his fasting glucose level.
Fasting blood glucose level.
Wow.
Remarkable result. He lost already more than 100 pounds. Okay, 100
So he's
pounds.
still 200 pounds, 200 something.
Exactly, 200 something, 220.
And so this tells me that you can still be maybe a little what would be considered overweight, but on track to being healthy. And your labs.
Because he was fasting for 2 days or 3 days a week. He's eating well. I mean, plant-based diet. I mean, he's walking 4 miles a day. He is walking after their meals. He's sleeping better. Well, he's doing almost everything.
That's incredible. One thing you said, he's fasting 2 or 3 days a week. Is he fasting consecutively or one day and then they're spaced out?
No, yeah, every other day.
Every other day?
Every other day.
And
you don't have to fast for 3 days, right?
in a row?
In a row. You don't have to, you don't even need to fast for 3 days every week, but at least 1 or 2 days every week, it's going to be more than enough. More than enough.
And at the very least, breakfast to breakfast.
Breakfast to breakfast.
Wow.
Yeah.
Okay, so we've learned a lot of exciting and good information about physiology and how we can treat metabolic syndrome. I shouldn't say treat, but help yourself and help those around you that may be struggling with any number of the 5 that are a part of metabolic syndrome. And so really, we just saw that metabolic syndrome is at the center of the leading chronic diseases, the leading killers in our country and really in the world. And so with just this simple information, you can go a long ways and you can really help yourself out and to be able to continue to be a blessing to those around you. So I'm so thankful that you came here to share this message of hope, really, to show that there's opportunity to be restored.
There's hope. There is hope. And I want to stress on this thought, right? There is no age to change those habits, okay?
There's no age too old to change those
Exactly,
habits.
yeah. And also, we tend to believe that it's so difficult. It can be difficult in the beginning. Yeah, it can be complicated in the beginning. But as long as you get into a new routine, friend, it's going to be some sort of doable.
It's going to become
feasible.
easier.
Exactly, easier, I would say. Okay?
So the hardest step
The
is the
hardest
first
thing,
step.
exactly. The hardest thing is what? Start. As long as you are starting, friends, you will see the change and you will see the results. And something that this individual was telling me, hey, so tell me, what is your motivation? My numbers. Seeing results, seeing results, seeing results, seeing results. So, hey, do it.
Do it.
Do it.
Like
just
Nike,
do
just do it.
Just do it.
Yeah. Not sponsored by them, but we are open for that. All right. Well, thank you very much for watching. And you are truly into learning about health, and you can stick through a lot of physiology if you've made it to this point in the talk. So we're so glad that you did. And real quick, how can people learn more about maybe either you or Uchee Pines?
Yeah, UcheePines.org.
Okay, UcheePines.org.
UcheePines.org. We're going to put the link below. And also Dr. Adan Sanchez Aleman, or Adan Sanchez Aleman on Facebook, and Dr. Sanchez Aleman on Instagram as well. And you can just call to Uchee Pines and ask for any providers over there.
Yeah, and they do actually phone consultations and phone conversations about health-related things. So definitely feel free to give them a call. And thank you once again, Dr. Sanchez. It was a pleasure talking with you.
Thank you, Josiah. My pleasure. And remember, change your thoughts, change your habits, live well. It's that simple.
Look at the camera now. This is our picture.
Now, okay.
Okay.
I'm still believing that the first one was the best.
Really?
Yeah, it was more